All right, so welcome everybody. My name is Allie, Petot. I'm our Women's Health Program Manager here at Springboard, an organization that has been running programs for women-led tech and healthcare companies for over 2 decades. We've had over 850 incredible alumni come through our programs that have gone on to generate over 30 billion in value. And I'm sorry if you just heard my dog, do its thing in the back. Over the years, we've had so many of our alumni specifically focusing on women's health. And so we decided to double down on that focus in building and supporting the women's health innovation ecosystem. So we launched the Women's Health Innovation Coalition in 2020 to bring together organizations and individuals, all like everybody on this call, that are advocating and promoting greater attention, research, innovation, and investment in diseases, conditions, and indications that exclusively, differently, or disproportionately impact women, really broadening our understanding of women's health. And this framework includes 7 segments that you can see on the screen. That includes autoimmune, oncology, aging and bone health, sexual and gynecological, reproductive, of course, being our topic of today, as well as heart health and cognitive and brain health. So after a successful forum series in 2021 and an outpouring of support for the Women's Health Innovation Pipeline, we decided to continue the forum series as a way to bring together the community of each segment, of course, 7 segments, 7 events of the forum series. And we do that to, of course, bring together the community and highlight the women doing the work in each space. So for our forum series this year, we first hear from patient advocates. A key piece of women's health that's so often overlooked is the voice of the female patient. So starting that off with our first panel, and then we'll then highlight the founders and funders in the space, looking at the state of investment, as well as putting a spotlight on the companies innovating with women in mind. We see this as a really important way to bridge the gap in women's health investment and to understanding the lived experiences of female patients. And we really appreciate having you all with us here today. And with that, I'd like to introduce one of our incredible partners on today's event, Stephanie Sassman with Genentech, to come on video and give welcome remarks. Stephanie, if you're able. Is she not there? All right, we will actually turn to Stephanie in a second, but also supporting the forum event today is Organon. To give welcome remarks, I'd like to welcome on video Lisa French, the Women's Health Business Unit Lead for Organon. Lisa, if you're there and can come on video. Might be having some tech issues today.
I believe Stephanie just joined us. So.
Oh, perfect. All right, Stephanie, if you're able to give welcome remarks today. Hello.
Yes, thank you so much, Allie, and great to see everybody today. At Roche and Genentech, we're really on a mission to transform women's health across diseases and to leverage our expertise in developing both diagnostics as well as medicines. My name is Stephanie Sassman. I'm our portfolio lead for women's health. And I think we can't find a better partner to be working on this journey with really than Springboard Enterprises and all of you. Because we really know that we cannot truly bring forward personalized healthcare if we continue to treat men as the default humans. And it's shocking and unacceptable that women's health outside of oncology accounts for only 1% of R&D funding for healthcare products and services. And I would argue actually that reproductive health is one of the most underfunded areas that we have. And it really threatens our entire future as a civilization, right? Because if we don't have reproductive health right, how are we going to continue our population? And women's health truly is population health. Women are accounting for greater than 90% of the healthcare decisions. They are the chief medical officers of their families, and they're also more likely to engage in digital health tools, but they tend to put themselves last. And that's why organizations like Springboard and the companies in the Women's Health Coalition are so important to really look at how we can put women first and putting them really at the center of what we do so that we can personalize women's health and truly deliver women-centered care. And this really comes from having a place of empathy and really understanding the current experience that women have when they interact with healthcare providers and the stakeholders in part of their health journey. And I think we all know that women's reproductive rights are one of the most frightening areas if we think about interacting not only with the healthcare system, but just with sort of anybody in our country in general, right? Our reproductive rights are under greater threat than they've ever been, likely in our lifetimes. And innovation in reproductive healthcare and the innovation that your companies are bringing forward are really part of helping address that gap. There's a lot that needs to happen. And so I'm also glad that Springboard is bringing us policy experts and funders in this space to come together. And Roche and Genentech are very happy to be supporting Springboard and to really encourage all of your efforts to lead the charge. And who better to lead the charge on this than women entrepreneurs and women funders? And we really need to be empowered to have important conversations about how we can actually take action around health innovations for women's health, particularly around reproductive health, and make sure that funding is allocated to support research and development of these diagnostics, treatments, and tools, and also that women across all spectrums receive broad access to these innovations. So thank you again for all of your efforts to innovate and create new technologies in this space, and looking forward to a very exciting session.
Thanks so much, Stephanie. And I don't believe that Lisa was able to join, but we're going to go straight into our first panel. We kick off our forum events with a panel focused on patient advocacy, an increasingly relevant area of focus as we have this ever-present spotlight on where, when, how, people that can reproduce receive healthcare. So I'd like to bring on our first panel to discuss advocacy in this space. For those seeking reproductive and maternal health care, I'd like to welcome on video Crystal Tyler, the Chief Health Officer of Rhia Ventures, and Linda Goler Blount, the President and CEO of the Black Women's Health Imperative. So thank you both so much for being here today, for being a part of this discussion. As leaders in health equity and improving clinical outcomes, can you share why advocacy in this space is so key, and some important nuances within reproductive health specifically, given current politics and recent legal decisions? Linda, if you want to take it away first.
Well, thank you, Allie, and thank you for this forum. This is what is needed at this moment in time, because the advocates have a lot of work in front of them, and entrepreneurs have a lot of work in front of them as well. Because the statistics that you gave earlier were really disheartening. 1%. But just, to kind of think about, where we are in terms of advocacy, the thing that sort of immediately comes to mind is we just don't have accurate information. I mean, people clearly this last few months show that people don't understand the basics of human biology, let alone anything sort of detailed and scientific. So advocates really have to connect the dots so that people understand the connection between reproductive health, economic stability, maternal mortality rates, and inequalities for Black and brown women and low-income women. They need to help explain how systems of care delivery matter. We've seen too many times stories of providers who don't listen to women during and after pregnancy, and the terrible outcomes that have occurred, sometimes resulting in death, because Black and brown women, low-income women certainly were not believed by their healthcare providers. And advocates need to talk about what happens if nothing changes. So an example of forced pregnancy, there's serious implications for adverse health outcomes, endometriosis, birth controls of treatment. Well, what if you can't have access to contraception? IVF, what's going to happen in certain states with fertilized eggs? Can they be discarded? Ectopic pregnancy, we've already seen stories of women being forced to go into sepsis so that the doctors can treat them for an infection rather than provide the reproductive health treatment that they should get. And then I think about the economic impacts, criminalization of the women, people who help them, of providers. What happens when people go to jail? They lose the right to vote. They may lose the right to even be employed. So advocates really need to look at this issue broadly and explain it in clear language, but also connect the dots so people understand what this means now and 5 years from now.
Right. Crystal, any thoughts on that?
Yes, so I absolutely 100% believe and agree with everything that was just stated. The things I want to add are really around the nuance, and that was part of your question also. So what's the nuance that advocates really need to bring to the table when discussing reproductive health? And I'll have to say that reproductive health has its own very special nuance. And as a reproductive health professional, I think it's more nuanced than the other health outcomes for a number of different reasons. The first one is that reproductive health is very intersectional, and it's intersectional in ways that are different from other health outcomes. So when I say intersectional, I mean that for reproductive health, identities that individuals hold collide in ways that are unique for their health outcomes. And in the reproductive health space, the identities that collide are typically identities that have historically been marginalized. So identities such as your race, or identities such as your gender, or identities with respect to insurance coverage, all of these things collide in ways that lead to disparate health outcomes. And it's important that advocates speak on these identities and why they matter for specific populations. This is especially important these days because our healthcare system in the United States is incredibly fractured. And when you have a fractured healthcare system and patients who have historically been marginalized due to different pieces of their identity, it's sort of a perfect storm of catastrophe. And it leads to all of the outcomes that were just mentioned earlier. So I'd say, like, just in recap, making sure that advocates describe the fact that reproductive health, there's nuance because these intersectional identities really collide and lead to disparate health outcomes for very specific populations with respect to gender and race.
Right. And I think to kind of double down on your point here, both you, Linda, and Crystal, that, reproductive health care is not just something that solely impacts women. I know that's something we talk about with the definition of women's health being conditions that solely, differently, or disproportionately impact women. And, with reproductive health, it's that really unique, like you said, perfect storm. All of those things come together where this is something that differently impacts us and disproportionately impacts certain, different sections of our communities. And so I think working across not just, reproductive health specialists, but, those in the gynecological and sexual health space, working with economists and people who are, understanding the structural equity standpoint of this as well, that it's, more than just access to care, but who gets that care and when. And with that, I'd really like to talk about kind of the intersection of reproductive justice and healthcare, what you both would like to share with people in the audience, specifically our entrepreneurs, on how those two things are intertwined. I'd like to start with you, Crystal, just because, with Rhia Ventures having a part of your framework being reproductive justice, how do you build that ecosystem with the founders that you bring through the fund?
Yeah, thank you. And I'll actually start because it wasn't included in the beginning with just a big picture definition of reproductive justice, so that folks on the audience really know. So when I respond to this question, this is the framework that I'm responding to. So reproductive justice, it's based on the human rights framework. It was coined in 1994, I believe, and it's the human right to maintain personal bodily autonomy. So the right to have children or not have children, and to parent those children that you have in safe and healthy communities, sustainable communities. So reproductive justice is not really just a term, it's really a movement. It's a set of principles and it's a set of values that define how we do the work that we do and define what matters in the work and whose voice should be centered in the work that we do. So that's sort of the definition of reproductive justice that we come with. From an entrepreneur perspective, it's tough because entrepreneurs, you enter this field and you got to make money, to be clear. I mean, you got to make money and you need to make money for your investors, but you also kind of want to save the world. That's why you go into that space. So it's this toggle between the end goal of making money, but the end goal of also advancing health and wellness, because the entrepreneurs who we work with are focused on reproductive and maternal health and women's health. I would say that there is a way for entrepreneurs to do both. You can save the world and center justice principles. They don't have to collide. They really don't. And it all starts with a stated commitment on the entrepreneurial team to say, we are committed to these principles. We are committed to equity. We are committed to this work and doing our work in a way that centers that. And if you start with that stated commitment, everything else sort of flows from that. And if folks have questions on how to embed those equity and justice principles, we are happy to support you on your journey. You don't have to be in our portfolio to get support in that.
Fantastic. Thanks, Crystal. Linda, thoughts on that?
Yeah, Crystal, 100%. I couldn't agree more. I think about those 8 women at that Chicago conference in '94. There were 150 women and 8 Black women who said, wait a minute, this isn't just reproductive health. This is a justice issue. And so, they talked about that. They talked about Kimberly Crenshaw and the term she coined, intersectionality. Black women historically have lived at the intersection of racial and gender oppression and economic oppression. And so I'm not an entrepreneur, I'm an epidemiologist, but as I think about this and sort of watching entrepreneurship, the only thing I would add to what Crystal said is try to do the innovation in a historical context. I think oftentimes entrepreneurs are very much in the moment, and even those who are committed to equity forget for Black women, the 400 years that got us to this point, for Latinas, the xenophobia, the status means, your immigration status, what that means. So somehow we need to bring that to bear on our innovation. We see in artificial intelligence, all kinds of bias. And we saw it with COVID, with, the pulse oximeter is not working as well on people with dark skin because we're left out. So, as much as we can be inclusive, but understand the context in which people live, it's not just this moment, it's the history that got us to this moment, and have that inform our entrepreneurship and our innovation. That's absolutely where I think we need to be, and trust those women to understand what's best for their health, because we've been doing this for a long time.
Yeah, absolutely. I think that's something that really trying to achieve that with patient advocacy is person first innovation. Your innovation will be successful if you center the person that you are trying to get that innovation to, and I think that that's a huge goal of the Women's Health Innovation Coalition, is really centering the women that are being innovated for and the women that are innovating for them. Because like you said, you need to, set these innovations in historical context, especially when it comes to reproductive health, given, the harrowed history of how this field came to be, and how innovations were even found in the first place. So I think, I really appreciate you both mentioning that. Crystal, I want to take a second. I know that you previously worked with the CDC as an epidemiologist. What does it mean to translate disparities of care into clinical practice? And how does that relate to your current role at Rhia Ventures?
So I'll say first, thank you for mentioning the CDC. I had such a great time at CDC. Are there any CDC colleagues on the call, Michelle? So I'd say the really cool thing about working at CDC is that it's like a ready-made melting pot of brilliance and scientific brilliance, but it also is so much easier to partner when you're at CDC because you have the weight of the CDC behind you. So when you're trying to come up with guidance, you have ACOG right there ready to partner and come up with guidance. You have the American Academy of Pediatrics, so you have everyone there with you. And it's a lot easier, at least I found, that it was really easy to partner when you're at CDC because you have the federal government there, you have this big name there, and it's a lot easier to come together with large professional organizations and partner to come up with guidance and recommendations and policy that could really impact health. The government can move at the government's pace, which can be a challenge for some, but I will say the exciting part of the CDC work is the ability to partner with organizations, professional organizations, and to really advance the work and make sure that it gets into the practitioners, the clinicians, the folks who are on the ground doing the work, to make sure that that guidance gets into the hands of those individuals.
Right. And Linda, I know you also worked at the CDC. Anything to add there?
Yeah, I too cut my public health teeth at CDC, and I agree. Crystal was being very kind. Sometimes they can move at a glacial pace. But, there are reasons for that. I would add that, the folks at CDC are certainly open and interested in innovation. I mean, they kind of have to be, but their ability to move is limited sometimes by process. The thing is, they will listen to ideas and help connect entrepreneurs like Crystal with other folks who are doing work in the space, even if they can't make it happen. We work very closely at the Black Women's Health Imperative with CDC, and what they have done for us is brought other partners so that we can take work that they've done, maybe the diabetes prevention program, tailor that for Black women, and then get it out to Black women through other partnerships without having to sort of wait on CDC to do that work. And the partnership has been great. And then they in turn have taken some of our ideas, incorporated into their work, and then use that to distribute to other partners, other people in the space. So I absolutely would not rule out working with the CDC or other government agencies, but I think have to set your expectations appropriately for just how quickly they can act and what the limitations are.
Right. And so what I'm hearing is, there's great success in coalition building, reaching out to other partners in the space, whether that's governmental or not. I know that, you all are trying to build that ecosystem in the reproductive and maternal healthcare spaces, so can you share with our audience? I know that we're in a time where optimism feels low, hope feels low. So I really want to take some time, I think, if at all possible, to kind of share some successes in your careers that you've seen that work, whether they're reproductive or maternal, healthcare related or not. I know that, Linda, you also worked with the American Cancer Association. So really sharing some wins that you've seen in achieving structural equity, what that looks like for women, and how our nonprofits on the call, our service providers, our entrepreneurs, our investors, what they can learn from those successes and, move things forward.
Yeah, it's kind of hard sometimes to be hopeful, especially at this moment in time, given all that's going on. But in reproductive health, we've seen some successes. I mean, we've got Title X, we've got the Affordable Care Act, which provided access to contraception with no copay. That obviously is under threat now. In maternal health, there's the Maternal Quality Care Collaborative in California that did show some improvement in maternal mortality rates. The improvement was not even across the board. It wasn't the same for Black and Brown women. And so there's still more work to do. Obviously, some of our federal legislators like Lauren Underwood and Cory Booker and then Senator Kamala Harris, were behind the Momnibus Act, talking about the importance of equity and the kinds of policy and systems of care changes that need to happen for maternal care. But, what I would say is all of that is wonderful, and we should absolutely build on that, but we need legislation with teeth. Advocacy, those who know me know that I say advocacy is necessary, but insufficient. We've been advocating for a long time, but we have to figure out a way to put our hands on where the levers of power are to determine access, quality, how care is delivered. So, for example, NCQA, the National Committee for Quality Assurance, produces quality measures. Well, what if we had quality measures around maternal and reproductive health that were based on race and ethnicity? I'm going to go way out on a limb and assume that if providers thought, both physicians, nurses, hospital systems, thought they were not going to be reimbursed because Black and Brown women died giving birth or during the postpartum period, somehow they'd figure out how to listen to them when they complained that they weren't feeling well. So I think we advocates have to connect those dots to money. We talk about following the money, and reimbursement and those repercussions or consequences for not delivering the quality of care that all women deserve. And I think if we can do that and build that business case, we'll make a whole lot more progress and hopefully make it more quickly.
That, is that the Springboard language is making the business case. And that just, perked my ears up about that. I think that there is such an opportunity in making, of course, there's an obvious case for serving women. It's obvious to everybody on the call here, but I think there you're right, there needs to be a centering of what happens when you don't give access to people, rather, because we've existed in a long time where care was only for these people, but what are we detracting when we're not reaching certain people? And I think that, we're seeing so many innovations in, culturally competent care and care specifically for Black and Brown women. And I think that there is, where there is an unmet need, there is a clear opportunity to create value. And I think that that is exactly where this conversation, I think you're right, has teeth, is saying, this is what you're missing out on when you're ignoring not just 51% of the population being women, but when you ignore Black and Brown women in that experience. And Crystal, I'd love your thoughts on that as well. Oh, and Linda, you had.
Yeah, I was gonna say, we saw some interesting progress with telehealth. Obviously, telehealth means you've got to have broadband access and some other resources. But many physicians actually found that by being able to look at a screen and see kind of what's happening in a woman's life, they were able to offer better care because they realized they didn't realize what her lived experiences were like. They didn't realize she's taking care of an elderly relative or the neighbor's children or her own children or other things that are happening, but by getting sort of a peek. So I can only imagine entrepreneurs like Crystal are going to be able to take that data and those processes and turn that into even higher quality care, because it's going to inform what providers do. And I would think inform the conversation and the relationship between the woman and her provider, so that the provider understands, oh, it's not that Mrs. Jones isn't compliant, it's Mrs. Jones has these kinds of life events, so I've got to change what I do to deliver quality care to her.
Right. Really meeting people where they're at, I think, is something that we saw in the pandemic and with telehealth is whole person care. There is a story to a person when they come into the room, and when you have a physician's visit or things of that sort, the whole person care is extremely powerful. Crystal, anything to share on that in terms of statistics that you see with Rhia Ventures and your career in this space?
So the only thing I would add is to underscore those small wins as wins. There are huge wins that were mentioned, and those absolutely matter. But sometimes professionals feel like they don't have a role if they can't create an Affordable Care Act. And there is a role for each of these professionals at every step in the process. So I guess I would add and underscore that for me, professionally, the wins that I've seen have been when individuals and organizations have turned that corner, when it came to really understanding what it means for equity. That provider who said, I thought I was doing this work the right way and centering my patients, but then I absolutely realized that I was bombing and I wasn't. And so when you have individuals and healthcare organizations and health systems turn the corner on this work, I count that as a win. It's not the end all be all, but it's movement and it's progress. And I would say that movement is a win.
That's an incredible point. I think that's something that we talk about a lot in advocacy, whether it's related to government policy or not, is this kind of burnout feeling of, how can I sustain this outrage that I'm feeling to drive progress? And you're right, we're going to burn ourselves out and not feel like progress is happening if it's not immediate. I know that we're at a time where kind of that instant gratification is what we're looking for. We want Affordable Care Acts every single day, but that's just, that's not possible all the time. And so I think centering those small wins and channeling, advocacy into something that works for you, and that you can see, tangibly build over time, I think is really important. And the question I have for you both is, with the recent legal decisions, of course, we're seeing this kind of erosion of the right to privacy. What should I know for a long time, it's been my body, my choice, the bodily autonomy is a personal thing for me. So where should we base our advocacy efforts moving forward? Where can we kind of center ourselves and have a productive conversation, to really continue our fight? It's a lofty question.
It really is. Well, I think I would start with, discussing and focusing on the science and the facts. We have entered this era a few years ago where for some people, facts and science don't seem to matter. we know with this recent ruling, the expectation is Black maternal mortality rates will increase by 33%. Overall, maternal mortality rates will increase by 21%. It's expected that the poverty rate for Black women will increase 15%. So sort of on with that as a background, it's kind of hard to find the hope in there. But those of us in advocacy, but also entrepreneurs, kind of need that as their background. This is what they're working against. I mean, yes, bodily autonomy, the right to make the best healthcare choices for your body is critical. But since this decision has pushed access to contraception care, obviously this right to choose to the states, entrepreneurs, I think, are going to have to be really innovative, because they're going to have to, their work is going to be influenced by what happens at state level. It's not just, we've got this great idea. It's, we've got this great idea, and what does it mean in Georgia? What does it mean in California? What does it mean in Missouri? And I think we need to understand the implications of well-intended efforts. Corporations have said, oh, we will give money for women to travel out of state if they happen to need abortion care. Well, there are a lot of women who will never take them up on that offer, because they can't risk having corporations get into their business in that way. There are women who will take corporations up on that offer and then find that their careers have stalled because of the stigma. So, I kind of come back to looking at the long-term consequences and, figuring out a way to put access to contraception and reproductive health services in the hands of women, even in this current environment. And I'll just sort of end with it, because I'm so glad Sophia is on this call. When I think about innovation, I'm looking at how do we stockpile medication abortion, Plan B, Ella. How can we get stockpiles? How can we get the logistics and the artificial intelligence so that we can figure out how to get these medications to women who need them? What are those extra legal strategies we can employ? Because, we advocates are going to have to focus on these long-term consequences. They're economic. There could be a talent issue. What if women decide, I'm not coming to Texas to work? What if corporations say, you know what, I'm not moving my headquarters there. In fact, I'm going to move out because of these retrogressive policies. And then you put governors in the position of explaining to their those who voted for them why they've got to raise taxes because of these backward abortion policies and other healthcare policies relative to women. So if there's a little glimmer of hope, that is, we advocates and entrepreneurs can use what we expect to happen, hopefully, to drive that kind of behavior, make sure that people understand what those consequences are, and hold their elected officials accountable.
Yeah. Yes, I agree to all of that. And I paused when you initially asked the question, because it's still heavy. It's still heavy. And abortion access is not the end all be all, but it's heavy, and it weighs on those of us who've been in this field for a while. I think advocates are going to have to fight on a couple different fronts. One is now that it's gone to a state level, you really got to fight for these state policies. You have to share the narratives and the stories of people who are personally affected by these decisions, because that seems to sway folks who are kind of like, that seems to help, and it seems to sway. So share those stories, get them out there, pull at heartstrings if it helps, please. We need advocates who are pushing for money and funding to figure out these implementation challenges. Having states that having states that have permissive laws, that's fantastic, but getting people there, getting the resources to those people, it's a challenge. There are all sorts of supply chain issues here. This has not been figured out. We weren't really prepared for this and the implications of this. So we need advocates who are going to push for the implementation things. We also need advocates to shed light on what this means for people, because it's not just reproductive coercion and it's not just medical trauma that has been legalized here. It's also the down the pipeline types of issues. It's not just about health and well-being. It's the fact that some of these births are coming into a system that is unprepared. Our healthcare system is fractured. Our education system is a mess. People don't have healthcare coverage. None of the US is built to sustain the population that's going to come from these repressive and coercive laws and policies. No one was prepared for this. This was not clearly thought out. And by the way, it's incredibly coercive and repressive and oppressive. So.
No, absolutely. I think, just with how the pandemic kind of revealed needs that we had in telemedicine and certain disparities in communities of color versus, our white communities, I think that, this is another opportunity yet again, where we're seeing, the women's healthcare community knew this was fragmented. We knew that this was an important issue to really focus on and keep progress in. And when you take away kind of that guaranteed, you take it for granted. And I think that that's something that we really have to collectively understand, that there's a ripple effect in this. Like you said, it's not just abortion care. That's a heavy place to start, but there is so much embedded in reproductive health care and this idea of bringing a child into the world when you want to, and when you do, having, a sustainable and healthy environment to do so. So kind of that book-ended idea of reproductive health care is important. And I think, to Linda's point about how now entrepreneurs are facing not just a fragmented women's healthcare market, but also you're going to operate business differently in every single state. So I think that, take this as an opportunity again to show the broader world that our healthcare system is broken. It hasn't been working for the majority of Americans, and it's now working even more fragmented and just repressive. And so I think really taking the time from, just seeing that from an individual standpoint, you can make a change in this. And that from, pulling the levers of power, that has to come from us to do so. So I think it's, we really try and emphasize in these forum series events and just broadly that patient advocacy isn't always a nonprofit. It isn't always, a healthcare association. It's you. And I'd really like to ask you both kind of what you'd like to leave the audience with in terms of how they can become patient advocates themselves. What can they do right now to kind of activate their power?
I would say, think about the generation of young girls coming along and the message this is sending them, that they can't be trusted to make the best decisions for their healthcare, that there's a group of people at various state elected officials in various states who feel like it's their right to make that decision for them and to force them to do things with their bodies that they're not prepared to do. And know that it's not right, and let that drive your advocacy. Be outraged and turn that outrage into innovation, because we need this, and we need to figure out a way to get around all of this, while those of us in the policy space are fighting to change these laws. But for now, we need the innovation that lets us get around it, so that we can send a very different message to our young girls.
Yeah, absolutely. And I would just say to audience members who are listening, there is a way to embed these principles of equity and justice into the work that you're doing. It starts with a stated commitment and saying that this is what you want to do. It starts with centering the people who've most been marginalized by all of the history and the systems and structures. And there is a way to do this work in a way that centers those individuals. So I would encourage folks to center people who've historically been marginalized in the work that you're doing. It changes the way you think, it changes the way you do your work, and it changes the outcomes that those on the receiving end of your interventions receive or have.
Incredible. You are both incredibly powerful people. And I just really want to thank you both so much for joining us. And unfortunately, we're at time. But I just want to, of course, thank you both so much for being here and for all the work that you're doing. I know that we had a bunch of questions in the chat. So if there were any specifically for Linda and Crystal, please let me know. If they weren't addressed during the discussion, I'll of course follow up with them after this to make sure that your questions get answered. But now I want to quickly move on to our founders and funders panel. We've talked about the power of coalition building in the face of emerging gaps in care, how this can be navigated by female patients and organizations, and how those innovating with such patients in mind can move forward. So I'd now like to bring on screen our incredible founders and funder to talk about investment in reproductive health care, what their innovations are, how they're looking to grow in this age of evolving and unfortunately re-emerging gaps in care. So hello, Maya, Sophia, and Rhia. If we could start with introductions from each of you, what your company is doing, and then of course from Rhia, what your mission is with SteelSky Ventures. Let's start with you, Sophia.
Hi, everybody. I'm Dr. Sophia Yen, and I know there were a lot of doctors on the previous panel, at least Dr. Tyler and MPH, I believe, Blount. Correct me if I'm wrong, but my mom said, claim all your titles. So everybody claim all your titles. I went to MIT, UCSF Medical School, and I'm currently a clinical associate professor at Stanford in the Department of Pediatrics in the Division of Adolescent Medicine. But the reason I'm here today, CEO and co-founder of Pandia Health. We are the only doctor-led, the only women-founded and women-led birth control delivery company. And we're building the online health brand Women Trust. We can deliver to all 50 states. So if you have a prescription and insurance, you pay us nothing. And we just make sure no one runs out of birth control in our lives. That's our mission and passion. And then we can prescribe in 14 states. And we strongly encourage birth control tourism. So if, for example, you're in New Jersey or Connecticut, unfortunately, we don't serve you right now for writing the prescription, but you could travel into New York, fill out the questionnaire, give us a blood pressure, pay us $20 once a year to use our expert birth control doctors. We only have doctors on our platform, academic doctors who are passionate about reproductive health. And the $20, as you know, is a total loss leader because far more value than you're getting. And that's Pandia Health in a nutshell.
Awesome. Thanks, Sophia. I mean, and also you did not mention your Springboard alumna, which when I came across your company, I was like, wow, if I had had access to that when I was 16 years old. And I immediately texted my mom and my younger sister, and I was like, you have got to check this out for Carly. So I just want to appreciate you for all you're doing for us, the teenage girls out there in the world as they're growing up. And getting access to birth control. Maya Hardigan, if you'd like to give an intro.
Hi, sure, Allie, thank you. I'm Maya Hardigan. It is such a pleasure to be here with all of you today. I'm here in the capacity of being the founder and CEO of a maternal health equity focused company called NAY. We are a company on a mission to reduce maternal health disparities for Black expectant mothers, and doing that in a digital first way, but also leveraging community-based resources, including community-based doulas, to ensure, very much in line with the conversation that was just being had, to ensure that the expectant mothers we're supporting have trusted and continuous support in their communities to drive positive outcomes. Pleasure to be here.
Fantastic. Thanks so much, Maya. And Rhia.
Hi, I'm Rhia Velissaris. I'm the founding partner of SteelSky Ventures. We invest in companies that create better outcomes, access, and care in women's health. Really excited to be here today with one of my great portfolio founders, Maya, and just talk about the need for more women's health funders, because you're going to hear today from two amazing women's health companies, and unfortunately, we can't fund them all. So we need to rally the troops so that we're able to invest more into this really important sector of healthcare.
Yeah, absolutely. And actually, Maria, I'd like to pose the first question to you. So Amboy Street Ventures recently released some statistics on the fact that while of all women's health funding, 25% of that goes to reproductive and maternal care. And now that seems like an incredible amount, but when you realize that, less than 1% of VC funding in general goes to women's health, now we're back down to about 0.6% of funding going to maternal and reproductive health, when it's a $200+ billion industry. So, I'd really like to hear more about SteelSky's inaugural fund, and why you guys are committed to investing in reproductive and maternal care first, and how what you saw in May and when you decided to invest.
Sure, that's a lot of stacked questions, but I'm going to get them all. So number one, you just said the reason why. Those numbers, no one's investing. So I'm looking to the market, looking for solutions. We don't have any, and no one's investing to give us any. And so who else is going to do it except for us? And less than 7% of VCs are women, and less than that are, women of color. And so it's really hard to be able to bring these stigmatized products and services and get men around the table excited about it. And so we took it upon ourselves to kind of be first movers in this space, show that there was a pipeline of great companies, show that they're creating better outcomes, and showing that they can create great returns for investors. And we're hoping that with our fund leading the way, we'll be able to pave the way for more investment in this sector. And so for us, we really look across the spectrum of women's healthcare, starting from maternal health to teen, to menstrual care, to pre and postpartum, to menopause and to aging care. So we're trying to find solutions for the life cycle of the entire cycle of being a woman. And there's 50% of the global population. This is a huge market, and it just boggles my mind that people don't think that, and that we're kind of the first people with Amboy Ventures and Rhia Health to kind of push the narrative and to show that this is a big space and this is a loyal customer. We all have the same needs every month, right? And so we're going through the same challenges. And so just thinking about one company and how big that can be because of the market is so big. One of the real focus areas for us last year was focusing on maternal health. As we know, the outcomes are terrible in maternal health for, Black women especially. And they like to cite the 3 to 4 times average. But what I like to cite is the 10 times. You're 10 times more likely to die in New York. If you're a Black woman, you're 8 times more likely to die in New Jersey. Those numbers are ridiculous, and we should be ashamed as a nation. And so much so that, Vice President Kamala Harris has deemed this a national crisis. And so we wanted to take it upon ourselves as a woman-led venture fund to invest very specifically in companies that can move the needle. And so when May came and pitched to us, this is exactly what we needed for the community. We needed companies that were putting women of color first, because we are the ones who are being left behind, and doing it in a culturally competent way that makes people have dignity and respect. And I would love Maya to share a little bit more about how she was able to do this.
Yeah. So I'm happy to spend a moment just talking about our why at May, but also how proud and humbled I am to have some of the strongest women's health investors behind us, right? So the why is clear, and we've been talking about it on this call today, right? Abysmal outcomes. But I think it's important to also recognize that beyond the impact that these poor outcomes are having on individuals, our children, our families, and our broader communities, these outcomes are driving huge costs into the healthcare system, right? And so when we think about our potential as a mission-focused entity, and one that's focused on equitable access and equitable care, that is one important piece of the puzzle, right? But it also behooves us to think in a very meaningful way about how approaches that better serve women and our target population specifically can bring unnecessary costs out of the system and return a strong ROI to the customers that we're serving. In our case, we're primarily serving payers, right? So pitching for me, I was very lucky in our first raise last year to have gotten investment from SteelSky Ventures and Rhia, but also the Rhia Health team, also the Avestria team. We had a handful of very strong women's health investors got behind May, right? And I think we were able to do that successfully for a couple of reasons. One is that the need is clear and explicit and burning platform right now, right? And this has been a problem for generations, right? The change that we've seen, I would say, since the summer of 2020 is a very public proclamation that has come from many large healthcare players, right? In the payer space, in the employer space, in the provider space, you name it, right? And a real need for those entities to stand by those commitments that they've made in health equity and really put some resources behind figuring out how to stand by those, right? So I think that attention is there. The problem has always been there. The attention feels very new over the last 2 years, right? So I think number one is just making sure that that is clear, right? How we as a company are serving, right, some of those equity objectives and serving this community in a very different and meaningful way. The second piece, though, when I think about our ability to raise successfully and to command partnership with some of these VCs we were targeting, was really thinking about how we are able to impact access in a meaningful way, and specifically thinking about opportunities to work with healthcare payers and to influence the regulatory space to really change the standard of care, right, and the expectation for how comprehensive that care should be. And so in the case of our team, we brought in operators, right? We brought in folks who understood very well B2B purchasing, understood very, very well the specific operational and financial priorities of some of these payer partners, but also the state Medicaid agencies, right? What did they need us to deliver? And how could we use the right language? How could we incorporate the right care approaches and support models into our product to make sure that we were successful in having those conversations? And I do think that we've been very successful in this first year on the market, really being able to move the needle in advancing some of those partnerships, which I think again is really meaningful because it is helping us to set a new standard of care for the mothers we're serving, where that has not been the standard for generations. And so we're really proud of that. And generally, Rhia made a point around, how can women's health companies actually command the attention of men in the boardroom and across the table and help them to feel a personal connection with this issue. And what I'm loving of late, right, is that there are so many more women investors, right, who have a specific and personal connection to this particular issue. And of course, we want all the men to be at the table too, in terms of wanting to invest and support women's health imperatives, particularly in this moment. But the fact that May and I, as May's leader, was able to work so closely with women's health dedicated investors, we didn't have to do a whole lot of convincing, right? We had to convince around our ability as a team to deliver. We did not have to convince around the need and what that could mean, again, to people and to broader communities. And so I think that was really, really important.
And another thing that really made Maya's team stand out is we see a lot of pitches. We see over 3,000 pitches a year, and we see a lot of passionate female entrepreneurs really wanting to make change in women's health. And it's one thing to have an experience, but it's another thing to have the depth of knowledge to be able to execute. And so that's what Maya's team brought. And she talked about their she talked about their deep experiences with payers and hospital systems. And she came to the meeting with, this is how we're going to go to market with employers. This is how we're going to go to market with payers. This is the cost savings that we can get. And so she really quantified everything. And it wasn't just an emotion pitch. It was a realistic pitch, because getting into payers and getting into these, hospital systems and health plans are really, really difficult. And for her to be able to navigate Medicaid is just a task in itself. And so for people to be able to understand how to do that and to do it successfully is really rare. And so that's what really stood out about Maya and her team.
Absolutely. And Sophia, I'd love to get your thoughts on that. I know that, since you operate in a number of states, what was that experience like for you, kind of building up, the ability to provide in New Jersey, New York, different states?
Yeah, I think that, what differentiates our company from others is we are one of the most experienced in the field, in our respective fields. So I have 20 plus years in reproductive health as a physician, as an advocate, as a feminist, and realizing that there are some crazy telemedicine laws out there. So out of the 50 states, some of them require you have to have a video or a phone, and there really is no call for that with respect to birth control. The American College of Obstetrics and Gynecology has said birth control pills, patches, and rings are safe. They can go over the counter. If you give women these 20 questions, they can answer them themselves. And the research has actually shown, they actually did this study where they gave it to women and they said, here's the questionnaire, and they gave it to a bunch of doctors, and the women actually did a better job on saying, oh, I can't take it because I have migraines with this kind of symptoms, than the doctors. And that's why our asynchronous telemedicine, which has a questionnaire that we ask all patients, has actually done better than an in-person doctor visit, because oftentimes when you meet with the doctor, they get distracted, or the medical student forgets to ask a question, or the resident doesn't remember this kind of thing. But if you ask everybody the same questions every single time, then you make sure that they get good quality care. And I think the future of telemedicine is about quality, not quantity. And the difficulties we've seen is that to open a medical practice in all 50 states, you have to have a physician's medical group, and they have silly laws that physician has to be licensed in that state, and all the board of directors have to be licensed in that state. So you either need to open 50 different medical practices, or you need to get your doctor licensed in all 50 states. So that has been a huge barrier on the telemedicine side. On the pharmacy side, it's similar, but not as bad. It's a lot easier to take a pharmacy to all 50 different states. And then with respect to innovation, Pandia Health, I realized I've spent 6 years of my life on birth control, and using my MIT, UCSF, Stanford brain, I wrote 2,000 birth control prescriptions in 2 years. That's more than most physicians, because most physicians write like one a week or a couple a day or whatever. And then I took all the birth control pills, ranked them from most likely to give you munchies to least likely to give you munchies, most likely to make you bleed when you don't want to bleed to least likely to make you bleed, and found a better drug. because I realized what I was taught at UCSF and Stanford, great for a Caucasian female that wants to bleed every single month. But for Asians and Blacks, found that this birth control pill works better for everybody. But if you're a Caucasian female that wants to bleed every month, I will do what I was taught at UCSF and Stanford. But I personally had to go through 3 different pills until I found one that works. And so right now we're using race as a proxy for genetics, but in the future, we're going to go, pharmacogenetics. And if you can give us your genetic, SNPs or sequencing from another platform, then we can then correlate it with race and give women the best birth control with the least amount of side effects based on what your genes will digest the drugs. And then the same thing can be applied to PCOS, can be applied to menopause, can be applied to obesity and other healthcare. So that, I think, is a key innovation, is to know that we're not all built the same and that there may be better drugs if we understand the genetics.
Yeah, absolutely. And what I'm hearing from Rhia too, and kind of what it was like to hear May pitch and things of that sort, and what I'm hearing from you both, Sophia and Maya, is, like we talked about before, I think that women are uniquely qualified to understand whole person care and the intersections of care and where that gets complicated for certain communities. And I think that, to Maria's point, there is, women by women for women companies are uniquely poised for success. And so I think coupling that with, the investment gap is a beast, and it's going to, it's both bringing men to, there's a huge education gap, of course, and educating men on why these things matter to us, but it's also, of course, proliferating the amount of women that are investors because we understand these conditions personally. And of course, a woman is, I believe, the status that they're 2 times more likely to invest in a women-led company. And so I'd love to hear, Rhia, your thoughts on that, on just like what your message is to the broader investment community and how you'd like to encourage more women to be involved in investment.
Well, I think it's difficult because even when women are involved in these larger venture capital firms, they're not leading the firm. They're not the final decision maker. So even though they bring these great women's health companies to the table, they may be one in a team of 12 on the investment committee, and they're going to get shot down every time because, do we invest in, aging menopause care, or do we invest in this really cool Bitcoin? That's the kind of conversations they're having. They want to invest in things that are fun, that they like. And that's not a lot of the most challenging problems that we actually need to solve in women's healthcare. So, number one is really being able to get elevated to decision-making power and putting real power in the hands of women. It's not enough to be a VC. That's why I decided to start my own fund. I could have joined a bigger one, but I knew I would get overruled every time. I knew the thesis. I knew that there were going to be returns, and I knew I would have to prove it. And so I had, conviction enough to go out and raise my own fund and start funding great companies, because another reason why a larger majority are not investing in women's healthcare is because we haven't seen the exits. We haven't seen the unicorns. There's, starting to be, with Progeny, and there was Everlywell, we're starting to see more, but there weren't enough to make a business case around it. And so there's a lot of pattern matching going on in venture capital. And you see, the guy in the hoodie who went to Stanford and Harvard, and, that's the one you fund. That's the backable one. You don't see, and it doesn't make any sense, because you see doctors here like Sophia, you see Maya, who went to Duke and Columbia and has amazing background and experience, but they're not getting the checks. And so we can't pattern match if there's not that, if there's not that many of them to pattern match to. And so that's another kind of mindset that we're going to have to change in the venture community. But I do believe that we're going to start seeing some of these companies continue to create outsized returns. And once we start seeing that, we'll be able to pull more people into the fold.
Yeah, absolutely. And I want to say, from an inaugural fund with SteelSky, starting off your own venture capital fund, what an incredible success to have opened SteelSky with. So just congratulations on that earlier this year. And no, you're completely right. I think we need a million mavens to kind of show the sea change that's possible with women's health. And I'd really like to ask Maya and Sophia, what are your next steps with the company? And I know that this question might have been different 6 months ago, but I'd love to hear, what you guys are doing next, and how people in the audience can help and, sink their teeth into that.
Yeah, I'm happy to start, right? I think this is a heartbreaking month for probably all of us here, right? And I think that there's an acknowledgement that we are losing certain agency right? In our decisions for how we grow and build our families, and doing that at a time where we're emotionally ready, physically ready, financially ready, and the like, right? And so when we think about May, because we are focused on Black expectant mothers and by definition, right, and based on, again, generational barriers socioeconomically, we are serving a more disadvantaged population, right? We're serving a population that's disproportionately covered under Medicaid. We're serving a population who already lacked some of that agency, right? If we just think about barriers and social determinants-oriented barriers to care, right? And so what we are anticipating, unfortunately, is that there will be much more of a need for what we're doing, right? We are expecting and anticipating that given what's going on in the economy, we're going to see more women on those Medicaid rolls. Given what's going on with Roe, right? We're going to see more women who are facing this particular life stage unprepared or lacking the resources that they need to do it successfully, right? And I think that's a heartbreaking thing. What I would just say is that it creates a fire in our bones, right? Because the need is even more there than it was 6 months ago, and 6 months ago the need was there, right? And so what we expect is that we need to focus again just on meaningful scale and access. And I think there's even more of a case to be made now, right? Particularly when we think about Medicaid plans, but also when we think about the employer sector, also when we think about the commercial insurance sector, and also payer providers, right? There is going to be more of a case to be made for saying this vulnerable population we're serving, believe it or not, has just become even more vulnerable, and we need to step up to the plate. And you can agree with us either because you believe it's the right thing to do for these mothers, or you can agree with us because it's going to be the right thing to do for your bottom line, right? Because the more unprepared we as women are to take on that life stage, the more we're going to see some of those avoidable outcomes, the more we're going to see mothers pulling away, right, from the deep and rigorous engagement we need throughout that pregnancy and postpartum experience to be in a position to care for those moms more meaningfully, right? And I don't say this from the perspective of victim blaming at all, right? I think the point was made earlier that if we are going to force these sorts of decisions, we need to be operating in an environment where we are providing these mothers with the resources they need to thrive and the resources they need in order for their babies to thrive. And that is simply not the case in too many states today, right? So the best we can do is support these mothers to give these babies a meaningful start, support these mothers as best we can with that whole person care to make sure that they have the highest possibility of support and success throughout these pregnancies, right? And so for us, it is just, it's more.
Right, absolutely. Like we were talking about before, just these evolving and reemerging gaps in care. And I think I really want to underscore, there is a clear, hidden, or I would say hidden in plain sight, of course, just the potential of women-led companies for success. The agility that you both have to run the companies that you do in the face of these legal decisions and, the political climate, I think really speaks to you both as leaders, and again, the potential of women-led companies, just broadly speaking. But Sophia, I'd like to get your thoughts on that question as well.
Yeah, so Pandia, I purposely chose because she's the Greek goddess of healing, light, full moon. And I also made up the definition, Pan is every and Dia is day. So it has always been our plan at Pandia Health to be friends with the people with uteri from their first period throughout their entire life. And so we've started with birth control. We're adding on acne. I'm of menopause age. So all my friends are like, menopause, menopause, menopause. And I'm like, yes, I will find the best menopause treatment. I will give it to all of you. And if you don't want it, then we'll give you other stuff, but we'll give you the best according to evidence-based, science-backed, cutting edge, academic, smartest, brightest in the country to protect your bones, to protect your brain, to protect your heart. And so the future for Pandia Health right now, we're seeing a huge surge, thanks to Roe v. Wade being reversed, that women and those with uteri are like, I need to get my birth control under control, automated. I absolutely advocate people to get the implant or the IUD, but if you aren't ready for that, we're here to make sure no one runs out of the pill or the twirl patch on our watch. And we can write for the pill, the patch, the ring. If you want anything else, go see your doctor. We can also write for the shot if you need it. But the near future, we're looking at menopause and applying our same academic lens to finding the best medication, seeing if there are different side effects. The negative and the future that we need is more menopause options. So there's only a few hormones that are available for menopause, but there's like 40 different birth control pills, but only a couple options for menopause. But there are some new drugs on the horizon, and they're exciting, but they're crazy expensive. And it's a cost benefit, question for insurers.
Absolutely. Absolutely. And I actually have a question for you, Rhia, about this with the reversal of Roe v. Wade. There, now more than ever, there's this kind of assumed risk of women's health companies down the line. Where is a company like May and Pandia going to sit 6 to 8 months from now? And how is, legislation going to impact them? So in terms of this assumed risk of, whether it's illegality or just, hard to get, care to certain people, what do you have to say to the investment community about, this potential that people think women's health is going to be more risky now more than ever, or things of that sort? Because I know that even 6 months ago, people thought that women's health was risky, but I just would love to hear your thoughts on that as companies like May and Pandia Health continue to go out and seek investment.
I think with the reversal, that they just became a lot more valuable. That many more people now know that they need access. That many more people are demanding these products and services to be delivered through different business models and different channels. And that is what Pandia is doing. That is what Maya is doing. And I think there's even a bigger opportunity here. And so we're really excited. We're shoring up our reserves to invest more and more heavily and doubling down on this space, because now more than ever, it's come to the forefront. It's visible for everyone in America. Before, it's okay, if you're a mom and you need your daughter to get on birth control, if you're thinking about these things, but now the whole nation is thinking about these things. The whole world is thinking about these things, and they're seeking out these types of services because we have to figure out ways to have alternative ways of access. They talked in the panel before about circumventing the system, and these startups are doing just that. And we were doing it before, and now it's just going to continue to pick up pace. And I've seen more entering to the market, trying to figure out how to help navigate. So I think this is a better time than ever to be a women's health company.
That is an incredible point. And that just filled me with such optimism about where we're headed for this, and just the power that all of you on this call have, and, you, Sophia, Maya, and Rhia specifically. And I just like to end our panel on that note, of course, because it's incredibly hopeful for the power of women-led companies. But I want to give Maya and Sophia a chance to let us know how we can get their resources, how we can have access to Pandia Health in May, and how we can share it with the moms that need it.
Yeah, I can dive in. So our website is meetmay.com, meetmae.com. Please send the Black expectant mothers you love our way. I think we are, we're live, we're ready to serve. We do have a D2C offering, but again, our primary focus is in the B2B space and working with plans, and then hopefully in the near term with systems and with employers as well. One of the things that I would just encourage, and I'm talking to health plans every week, sometimes by the dozen, right? And one of the things that I would really encourage is just sharing stories, right? And asking your plans for what you need, because what I would really say, and I'm learning as I go, is that these plans are listening, right? So they're looking at their quality scores, they're looking at feedback on member experience, and they're looking for solutions to address those unmet needs, right? And these are actually linked to some of their quality incentive dollars that may be coming from the state in the case of Medicaid plans, right? And so the more these plans are hearing, I'm interested in doula support, I'm interested in culturally competent resources and education and the like, the more the plans are hearing that directly from the members, the more amenable they are to covering those related services, right? And so I think that helps the cause of May and companies like May, who are really trying to not only be present and available for expectant mothers, but who are trying to do that without any out-of-pocket pay for those mothers, and making sure that we're on a meaningful path to reimbursement. They need to hear that from each of us. So I think that's just one call to action for the group.
Absolutely. And incredible, just seeing that the uptake needs to happen when women demand the care that they deserve, I think is really important. Absolutely. And Sophia.
So anybody you know on the birth control pill or Torla patch that has insurance or has cash, know that it's quite affordable. It's literally $15 per pack of pill, less than 50 cents a day. And that's the good stuff. The stuff that only works for Caucasian females that bleed every month, that's like $7 a pack. So if you're Caucasian, you want to bleed every month, lucky you. But the good stuff is $15 per pack, and it is just what it is. We're not trying to jack it up or screw people. It's just, if it were me, my daughter, my friend, my patient, I would get the good stuff. And that's my new hashtag, get the good stuff. And I've dropped in the chat Dr. Yen's top 6 tips now that Roe v. Wade is over. So a quick plug for Plan C pills for anybody who wants any information about medication abortion, National Network of Abortion Funds, and Ella versus Plan B and its generics. Know that Plan B, if your BMI is 26 or greater, which is 60% of the population, not so good. And so if you have a doctor and insurance or a doctor and no insurance, get a prescription for Ella because it works up to a BMI of 35. It beats Plan B at every time point. And again, if it were me, my daughter, my friend, I would want the lowest possible chance of being impregnated if the condom popped or if I was sexually assaulted. And I also dropped Pandia Health socials. So please follow us on all the socials. Please amplify us, and know that we have an Instagram live generally, or Facebook live first or second Tuesday of each month at 5 o'clock Pacific in Espanol and 5:30 in English. And I bet you I'm happy to take on any CEO in the birth control area for Spanish off, because I studied Spanish for 12 years. So that's Pandia Health. Thanks for spreading the word. Oh, we're raising a $7.5 million round. If you know investors, send them my way. And we're also doing an AngelList roll-up vehicle. So if you're an accredited investor, have $1 million net worth outside of your home, check it out.
Fantastic. Well, thank you all so much. I get chills every time talking to you, incredible founders and funders. So I just want to extend a huge thank you for all the tireless work that you're doing in this space, for both having, allowing women to have a baby when they want to with dignity, and really reaching, the communities that need this care. So just, and a huge thank you on behalf of Springboard and the coalition and women everywhere, for all that you're doing. And I want to now introduce Amy Sanchez from the G2G Consulting team to give us, really vital updates on how we can take this collective outrage and this drive for pushing things forward in reproductive health, and how we can take that to the Hill. So take it away, Amy.
Awesome. Thanks, Allie. As Allie mentioned, I'm Amy Sanchez. I'm Government Affairs Director with G2G Consulting. I'm here to give you kind of an overview of the policy perspective on reproductive health. Congress has been incredibly busy in the area of reproductive health, most recently after the leak of the draft Dobbs opinion and the ultimate release of that decision. Much of the oxygen in the room on Capitol Hill has been consumed by access to abortion and contraception. On July 15th, the U.S. House of Representatives voted to pass a bill protecting abortion rights for the second time in less than a year. The vote on the Women's Health Protection Act, or the WHPA, passed 219 to 210, which is really a narrow 9-vote margin. If enacted, the bill would protect the right to access abortion on the federal level. In addition to voting on the WHPA, the House passed by a vote of 223 to 205, which is a little bit wider margin, another piece of federal legislation to protect the right to travel to access abortion care. The Ensuring Women's Right to Reproductive Freedom Act of 2022 would prohibit interference with the provision of, access to, or assistance for abortion care across state lines. Some other bills include, on the Senate side, we have S 3713, the Reproductive Choice Act, introduced by Republican Senators Collins and Murkowski, which attempts to codify the principles of Roe. Specifically, the bill prohibits states from imposing a quote unquote undue burden on the ability of a woman to choose whether or not to terminate a pregnancy prior to fetal viability. The bill would continue to allow states to enact regulations while clarifying that unnecessary health regulations that have the purpose or effect of presenting a quote unquote substantial obstacle to a woman seeking to terminate a pregnancy constitutes an undue burden. And the bill would continue to permit states to restrict the ability to terminate a pregnancy after fetal viability, except when necessary to preserve the life of the health of the woman. Another bill kind of in this space includes the My Body, My Data Act, which introduced by Sarah Jacobs of California in the House and Mazi Hirono of Hawaii in the Senate. It's the first congressional action to strengthen digital privacy and protect personal reproductive health information specifically, which is important to innovators in the digital innovation space. Additionally, the bill would create a new national standard to protect personal reproductive health data enforced by the Federal Trade Commission. Finally, we have the Labor, Health, and Human Services, Education, and Related Agencies FY 2023 spending bill. It's a mouthful, which eliminates the Hyde and Weldon amendments. The Hyde amendment blocks federal Medicaid coverage of abortion. The Weldon amendment threatens state and local governments that seek to protect or expand abortion care coverage with the loss of federal health dollars. These are amendments that tend to go in every labor HHS spending bill every year. This year, of course, as in previous years, the bill eliminates these two amendments, and is a pretty contentious point of contention in the House between the parties. Additionally, in the larger reproductive health space, the bill allocates $500 million to the Title X Family Planning Program, a significant and meaningful increase from last year's enacted levels. It allocates $130 million to the Teen Pregnancy Prevention Program, $64 million for the Office of Research on Women's Health, and $48 million for the Office on Women's Health. There are additional provisions for endometriosis, uterine fibroids, gynecological cancer, and others. If you're interested in getting the full list of appropriation provisions of relevance to the Women's Health Coalition, let me or Allie know, and we're more than happy to provide that to you upon request. Go to the next slide. Now, in terms of kind of a response to all this activity on the Hill, the White House has kind of had its own response. On July 8th, the president issued an executive order protecting access to reproductive healthcare services. The EO attempts to safeguard access to medication abortion and emergency contraception, protect patient privacy, launch public education efforts, and bolster the security of the legal options available to those seeking and providing abortion services. Specifically, the EO directs HHS to take action to expand access to emergency contraception and long-acting reversible contraceptions like IUDs. Under the EO, the department will ramp up outreach and public education efforts on abortion to ensure that Americans have access to reliable and accurate information about their rights and access to care. In preparation for the expected legal challenges, particularly at the state level, the Attorney General and the White House Counsel are convening private pro bono attorneys and organizations to provide more legal representation to those lawfully seeking abortions, as well as those providing them. The executive order also focuses on protecting patient privacy. The president is asking the chair of the FTC, the Federal Trade Commission, to consider taking steps to protect consumer privacy when seeking information about reproductive health services. The White House has directed HHS in consultation with the Office of the Attorney General and the FTC to consider options to address deceptive or fraudulent practices and protect access to accurate information. The EO directs HHS to consider additional actions to safeguard sensitive health information related to reproductive health care, including under the Health Insurance Portability and Accountability Act, which we all know is HIPAA. Under the EO, Secretary Becerra has directed the HHS Office for Civil Rights to issue new guidance related to HIPAA privacy rules to clarify that doctors and medical providers are in most cases not required, and in many instances actually not permitted, to disclose the private information of patients, including to law enforcement, which is really important as we talk about the criminalization of reproductive healthcare access. The office will also issue guidelines for consumers on how to protect personal data on mobile apps, which is important to digital innovators. The order also looks to ensure the safety of those seeking, as well as providing abortion care, including by protecting mobile clinics that have been deployed to provide care for out-of-state patients. Now, as I mentioned a moment ago, as part of this EO, the Justice Department announced the establishment of a task force, the Reproductive Rights Task Force, on July 12th. The task force formalizes an existing working group and efforts by the Justice Department over the last several months to identify ways to protect access to reproductive health care in light of Dobbs v. Jackson. The task force will monitor and evaluate all state and local legislation and enforcement actions that threaten to infringe on federal legal protections relating to the provision or pursuit of reproductive care, impair women's ability to seek reproductive care in states where it is legal, impair individuals' ability to inform and counsel each other about the reproductive care that is available in other states, or imposing criminal or civil liability on federal employees who provide reproductive health services in a manner that's authorized by federal law. Additionally, the task force will identify such actions and coordinate appropriate federal government response, including proactive and defensive legal action where appropriate. We'll get more guidance from the Department of Justice on what that actually means in coming months. As with the appropriations bill, if you're wanting a summary from the White House on the executive order or the actual announcement from the Justice Department on the task force, please let me know or let Allie know, and we can absolutely send that to you. If I could just kind of leave you with some final thoughts. All of that is kind of a snapshot of what's happening, but it's really important to note that all the activity taking place on Capitol Hill, including the larger appropriations bill with kind of the full gambit of reproductive health provisions, and the activity in the White House is happening against a backdrop of an upcoming midterm election in November. And then shortly after that, the launch of 2024 presidential campaigns, which will kind of, it'll only take a few months for those to kind of start after the midterm elections are over. Because of that, these types of decisions or discussions around the nuance in the policy are so important, because without a concerted effort by advocacy organizations, by practitioners, by entrepreneurs and innovators, much of that policy nuance around all aspects of women's reproductive health is really going to get lost in the political discussion around specifically abortion as we get closer to the election. So that is the policy discussion. There's our contact information if you want to get a hold of us. We're right there. We're an email away.
Thank you so much, Amy. And so as someone who lives in DC, it's always great to know kind of what's happening in my backyard and how, we can let people know how to get involved and, what the activity is on the Hill. So thank you so much for such a comprehensive presentation. And for the parting thoughts of vote, keep yourself engaged, I think is something that's always really important. And I appreciate the presentation. So thank you all so much for joining today's event. It's always incredibly energizing to hear the passion for driving women-centered care, the avenues for political advocacy, and we hope that you all sustain that you keep that momentum. And so you'll get a follow-up email from us with the recording to today's event, resources from our incredible speakers, and a contact list of all of those that registered, so you can stay connected to each other and have further networking opportunities to partner, collaborate, and just share resources. So please reach out with any questions, resources you want to share, or anyone that you want to get in touch with. Please let me know. If you have any further questions about policy and all things government advocacy, please get in touch with the G2G team or myself to help get in touch with them. Their contact information was up on the screen, but it'll also be in the follow-up email, and it's also in the chat for everyone to grab there. I'd like to give a quick shout out to a webinar hosted a couple of weeks ago by Beyond the Paper Gown, one of our incredible Women's Health Innovation Council members, Mitzi Crockover. It featured not only a number of our coalition members, but some that were on the call today. And Mitzi tackled a number of vital issues raised by the dropping of Dobbs and entering a post-Roe world, including individual rights and privacy, healthcare benefits and access to care, and of course, business, innovation, investment. So anything on that front related to a post-Roe world, I guarantee you she covered it. So we'll be sharing the link to watch that in our post-event email. So stay on the lookout for the email for a number of reasons, but also, of course, to get access to that incredible webinar. And just to conclude, I'd like to leave everyone with this parting thought of just find ways to collaborate with each other, to lean on each other, send resources to your daughters, your sisters, your friends, all the women in your life, and share this passion that we had today and make sure that it continues beyond, of course, the bookends of our webinar. We appreciate you all joining, and we really look forward to the progress that you're all driving and what we can achieve together. So I'll see you at our next event at the end of September. Springboard also has 2 in-person events coming up, one in Kansas City and the other in Chicago. So we'll share our in-person events as well as our virtual ones in the follow-up email. But thank you all and have a great rest of your afternoon.
Thank you, Allie, and all panelists.
Thanks, Stephanie.
Thanks, Allie, and thanks to everyone who spoke. This was such an informative and really wonderful hour together. So thank you so much.
Thanks, Katie. Bye, y'all.